Hello, and welcome to your Total Joint class, courtesy of your friends at Olympia Orthopedic Associates. Our number one goal is to get you back into the life that you deserve, a life in motion. And today, we'll be going over how to prepare for surgery and what to expect when you go home. Let's get started. We offer 3 types of lower extremity joint replacement surgeries here at Olympia Orthopedic Associates: the partial knee replacement, the full knee replacement, and the full hip replacement. No matter which of these 3 applies to you, the preparation is going to be the same.
All in all, joint replacement surgery is basically a resurfacing of that damaged joint. So there's a loss of cartilage, or maybe you had some trauma in the past. Now what the surgeon will do is just go in and take off that damaged tissue and place a nice protective covering made of metal or ceramic pieces and plastic components. So for partial knee replacement, a lot of times this is diagnosed by x-ray. You go in, you see your doctor, your surgeon, and they say, one side looks really great. The other side, not so good. So there's a narrowing typically, and you can see arthritis in that x-ray. So they may have the option for you to do a partial knee replacement. Recovery can be a little bit quicker with partial knee replacement because obviously there's a little bit less trauma. However, we still have those patients do the same amount of physical therapy and so on and so forth. So with full knee replacement, obviously there's not much to salvage over on this knee. That one's hurting pretty bad. Again, protective covering after all of this damaged tissue is taken off. There is a protective covering that's placed. There is medical grade plastic that sits in between these metal pieces that forms that cushion. And then a lot of times the surgeon will also put a plastic piece on the back of the kneecap or patella because there's usually arthritis that's involved with that. This implant model over here kind of has that little, we call it a button, but a little plastic piece there. And so for hip replacement, again, same concept, different joint. Surgeon will go in the acetabulum at that hip and take off any of that damaged tissue, place a protective covering inside that. And then this femoral head right here, the top of that ball, will be replaced with a metal or ceramic piece, and it will attach to a stem or a big kind of metal piece that goes down into your femur, your big bone here. Now the femur is already hollow, so they just kind of make it fit for the implant.
Joint replacement is a major surgery, and although advances in technology, medical care, and screening have made the procedure very safe and effective, there are still potential risks to guard against.
Okay, so there are risks associated with any surgery. This isn't to concern anyone, it's just so that you have the education of what to look out for when you do return home, okay? So the most common risk associated with this is blood clots. So blood clots typically will develop in the lower extremity or lower legs in your calf area. That's the most common place for them to form. They can form anywhere, and a lot of times this has to do with just that trauma to the bone and the fact that you probably aren't going to be moving quite as much after this type of procedure. I mean, as much as you normally were for the first couple of weeks, right? So things to look out for. So increased swelling in the calf specific area, and it can be the operative or the non-operative side. Patients will oftentimes experience tenderness in the area if they do develop a blood clot, pain, sometimes it can be extreme, sometimes it isn't. So really we want you to let us know if you're feeling any discomfort in the calf area or if you have increased swelling in that calf area, okay? Those are not 911 calls or emergent, but we definitely need to know because we need to send you in for an ultrasound to see if there is a blood clot there. Now, with that being said, we are going to do a lot of things to help you prevent blood clots when you go home, okay? The first thing that you're going to be prescribed are these lower extremity compression sleeves. They look like this. We like to call them leg massagers. But what they do is they're worn around the calf area, Every 10 seconds or so, they will fill up with air, give your calves a little squeeze, and then release. What are sequential compression sleeves? Sequential compression sleeves are devices that you're going to wear around your lower extremities to help prevent blood clots. These devices should be worn when you're most at rest. When you're up and moving around, it's okay to take them off. You are going to wear these for about 2 weeks in the post-operative period. When you are resting during the daytime, simple ankle pumps also helps get that blood recirculating. And then also you're going to be prescribed aspirin after surgery. So we prescribe 2 81 milligram aspirin daily for about 6 to 8 weeks post-operatively. How is aspirin useful in preventing blood clots? Aspirin is useful for most patients in the post-operative period to help prevent blood clots because it will act as your blood thinner. Now, patients are at most risk for developing blood clots after this surgery because it is a major surgery. Now, you do need to be active afterwards. You need to be up and moving. Aspirin, in addition to your sequential compression sleeves, will help prevent blood clots in that post-operative period. What if I'm already taking aspirin? Now, if you're already taking aspirin prior to surgery, that's okay. We just have you discontinue it 10 days before your surgery date. Now, in addition to your aspirin, you do need to discontinue any anti-inflammatory medication and supplements that you are taking 10 days prior to surgery as well. With any surgery, there is a risk of infection. We want to do anything possible to prevent infection. With joint replacement, if an infection is to get inside that joint space, it's extremely hard to get it out of there. So with that being said, it's very, very important to take care of your health before and after surgery. If you develop any skin problems, if you suffer a burn or anything like that, please let us know because that's access for germs to enter to your body and we don't want that. So things to watch out for: increased redness around that incision area. So if your incision, I usually tell patients if that incision starts to look pretty bright red and kind of angry, definitely give us a call. You will have some heat around that incision. You will have a little bit of redness, which is kind of normal, but if that redness gets really, very, very bright. Other things to note: any drainage that is not bloody, so your drainage should start out bloody. You will have bleeding under that bandage. That should reduce over a week or so, and then your drainage should go away. So say 2 weeks down the road, you have this sudden onset of drainage from your incision. That's kind of a red flag to us as well, okay? Now the dressing that you will be sent home with is antimicrobial. It's called Aquacel. What is Aquacel? Now, Aquacel is a special dressing that you are going to be sent home with after your procedure. This dressing can stay on your skin for at least 7 days. It's antimicrobial, so it will help prevent infection. However, if you are sensitive to latex or adhesive, please make sure you do remove it if you are experiencing any redness or irritation. If that occurs, it's okay to place a new sterile dressing that you receive from the pharmacy over that incision. Just secure it with some paper tape. So it is silver infused, helps prevent and wick away any of that moisture from sitting on that incision. This can stay on for about a week, so you won't have to do a lot of dressing changes in that first week. I would recommend picking up some sterile gauze or something like that and just some simple paper tape that you can utilize after you remove this, okay? What should I know about dental procedures after surgery? Now, dental procedures have been shown to increase your risk of infection around joint replacement surgery. So we ask that you refrain from having any dental procedures 2 weeks before surgery and wait for 6 months after your surgery. Now, when you do go back to the dentist, please give us a call because we are going to prescribe you a dose of antibiotics to take prior to any procedures with the dentist. All right, another risk: limited mobility and range of motion. Now, we're having joint replacement. We want better mobility and range of motion, right? So this unfortunately happens because you don't bend or straighten right off the bat. So scar tissue starts to really set in, and this really is focused towards knee replacement patients. Scar tissue can form right in that knee joint pretty quickly. So really you need to work and push yourself to get that good range of motion right after surgery. We expect that you do exercises at least twice daily, and then you will be going to physical therapy in addition to. So please set up your physical therapy before you even come in for surgery. How does limited mobility occur during the healing process? Now, we want you to be back to that life in motion. After surgery, it is going to be very important for you to get up and move as much as you can. In addition to that, you are going to need to work with physical therapy and maintain a home exercise program. If you stick to all of these, you will be back to that life in motion. What can we do to jumpstart the healing process? Now, around your surgical period, it is going to be extremely important to take the best care of your health. Limit tobacco, limit alcohol, and maintain a healthy diet. Also, it's very important to stay hydrated, so have that jug of water next to you at all times. One thing to also think about is your bathroom. Now, eventually you're going to want to take a shower, so make sure that your assistive devices can fit inside the doorways and also provide non-skid for inside and outside your shower. Now, showering is completely okay after surgery, but tub bathing is not. You're going to want to refrain from tub bathing for at least 6 weeks or until your surgeon approves you to do so. The last thing about your bathroom to consider is the height of your toilet seat. Now, if a toilet seat is extremely low, it's going to be that much harder to get up off of the toilet seat. One thing that you can purchase is a toilet seat extender. So if you do right now feel like it's a long way down to that toilet, it might benefit you to purchase that device. Now, you're not going to be preparing your meals by yourself after surgery. So again, it's very important to either coordinate with your caregiver to help prepare those meals or prepare ahead of time so you have easy access meals after your surgery. Will I receive instructions from the doctor after surgery? After surgery, you're going to receive a packet of personalized instructions that is going to be directed towards your care in the post-operative period. Please make sure that you follow these instructions closely and refer to them if you do have questions or need to reach out for further instruction. What is the pain going to be like post-surgery? After surgery, you are going to experience some pain. However, the pain is going to be manageable. Your surgeon is going to prescribe you medications to help control this pain. And the pain is going to dictate what activities you should be doing and what activities you need to back off. What should I know about pain medication? Now, your surgeon is going to prescribe you opioid pain medication. These opioids should last you about a week. Please make sure you take them as prescribed and do not ever mix alcohol or any other medications known to interact with these drugs. Now, your opioid pain medication can be refilled if you have pain that extends beyond this week. Please make sure you give Olympia Orthopedic Associates a call 2 days before you run out of this medication so that we may provide you with this refill request. What can I do to mitigate pain without medication? So after surgery, there are many other things that you can do to help reduce your pain level. Now, icing is going to be one of the best things that you can do. You can ice for 30 minutes on, 30 minutes off throughout the day, and you can do this for as long as you need to. Other things that you can do to help decrease your pain level are incorporating non-prescribed medications such as Tylenol or anti-inflammatory. Just make sure you refer to your surgeon's instructions.
Thank you for watching this brief video on total joint replacements. We hope that you were able to gain valuable information to help you in your overall healing after your surgery. Remember to pay close attention to your doctor's instructions, and for more information, please visit us at OlyOrtho.com.